Indaba is a gathering of people of a specific grouping with a specified agenda to address a problem affecting their existence. So in our case, we're applying it to the professional circles. Inspired this Indaba is the existence of disparity in information dissemination and levels of awareness of our nurses and midwives across the country, be it in training institutions as well as in health facilities, meaning hospitals. So this is a platform that Nursing and Midwifery Council of Zambia would like to utilize to bridge that gap by bringing key professionals, nurses and midwives at one place and share scientific papers as well as best practices that are happening internationally and globally so that we are able to improve service delivery to our mother Zambia. Yes, the schools and tutors, including students, our major stakeholder in this whole process, because there will be a lot of information sharing so that people know what methodologies to use when teaching and also how to handle patients and all the best practices that would improve the overall patient outcome and reduce morbidity and mortality in general.
Basically, I've worked for 23 years as a nurse. Nursing and midwifery is a regulated profession, and we are taught that we have to be submissive. But that day when I reported for work, I was told that no, Beauty should go back home. So she was advised, I think the husband didn't allow her. In the moment of waiting for the husband to come back now to make a decision, that woman fitted, took to theater, and she died. I was happy that one student challenged the quiz master. Our Indaba, our primary target are the nurses and midwives, but we also extend our invitation to our stakeholders. There are many opportunities for nurses and midwives, and the performance of students was better then than now. We are encouraging the nurses and midwives and all stakeholders that are interested in nursing and midwifery to come and join the Indaba. I just want to encourage them that if they want their training institution to be performing well, they should send their lecturers to come for this Indaba.
It will be very unfair for our viewers who are listening to us not to discuss the most recent trending video of a copper belt girl. Are you being harsh on the young lady?
It's not really about the video itself.
Welcome to the Smart Podcast, where healthcare meets hustle. Each week, we bring you inspiring stories from nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable advice.
Welcome to yet another special episode of the Smart Podcast. So many people will tell you that nursing is a noble profession, and maybe nurses, if you have conversations with them, will argue against all odds to defending that saying that indeed nursing is a noble profession, and this is why we give so much respect to them. Of course, they also save lives. I am your host, Gift Kalaba, and of course I'm joined by Tendai, who is always on the other side of me, hosting the Smart Podcast. Tendai, how are you?
I'm fine, thanks, and how are you?
Good to see you not in uniform today.
Yeah, it's good not to be new for once in a while.
Good. So remember, our Smart Podcast is being sponsored by Elitrasmart Medical Supplies Limited, your number one provider of healthcare attire. So like we always say, if you are a nurse or maybe just practicing in that hospital or healthcare facility, Elitrasmart is your number one to go, because they are going to tailor your uniform in a perfectly well done manner. But today on set, joining me is a name familiar with most of us, because she sits on top of the nurses and of course the midwives in Zambia. Madam Beauty Zimba, welcome to the Smart Podcast.
Good afternoon, and thank you for the invitation.
Yeah, we were having a conversation. Interestingly, you started this profession as a registered nurse, and of course worked for around 4 years until you are seated now on the apex of the profession. You are heading the Nurses and Midwives Council of Zambia. Just briefly run us through how your journey in this profession, how has it been? How did it start even?
Thank you, and thank you very much for that question. So Beauty Zimba joined the nursing profession in 2002. I was trained at a secondary school where they'll guide us which professions you want to join. So nursing was one of the opportunities that they had guided us where I was trained. So when I completed school, I had planned to be an accountant or a nurse, but my uncle then told me, no, I think it would be best to become a nurse. So I enrolled at Lusaka College of Nursing, finished my nursing training, diploma in nursing, and worked at University Teaching Hospital in medical wards, many various medical wards. Then after 4 years of working as a nurse, a registered nurse, I enrolled into a midwifery school, Lusaka College of Nursing, which is based at University Teaching Hospital. And when I finished my midwifery program, I worked in labor wards. I like delivering women and babies, helping women have babies that are alive. So I worked there and rose in the profession as a nurse. So basically, I've worked for 23 years as a nurse, as a registered nurse, midwife. I worked as a general nurse, promoted to nursing sister, managed many wards, got my bachelor's degree, and I proceeded to work as a clinical instructor in a midwifery school, and heading a department, neonatal department at University Teaching Hospital. And so I liked mentoring young nurses that were joining the profession, because I myself was mentored. And from that background, when there was an opportunity, I joined the Nursing and Midwifery Council as a very junior officer. As a nurse. My role was providing guidance in training materials for nurses and midwives. That was in 2016, and I worked in various positions as a nurse in the council until I assumed this role.
Interesting. Quite a journey. One would think that journey had no challenges. Really, just briefly tell us about the challenges you encountered, especially during the start of your career, and how you managed to navigate through those challenges.
Thank you. For you being a nurse and midwives, you find challenges even in the profession, just like any other professions. Nursing and midwifery is a regulated profession, and we are taught that we have to be submissive to your supervisors. One challenge I'll tell you is I was working in a medical ward, a different ward, but that day when I reported for work, I was told that no, Beauty should go back home because you should start night duty in a different ward, because there was shortage in a different ward. I abided by that. I went back home and went for night duty in a different ward. But what I want to say is commitment to duty. When you're committed to work as a nurse and midwife, even in the various positions you are given or challenges that you have, whether it is in leadership in nursing and midwifery or the circumstances where you're working from, because there's sometimes when you do not have enough equipment and materials to use as a nurse, you are able to improvise so that you're able to give quality nursing and midwifery. And so for young nurses and midwives, I think the overall, what has helped me is to maintain my integrity as a nurse and a midwife, committed to duty when I'm called upon. Even when I was off, if they tell me that your colleague is off duty or your colleague has a funeral, we have no one to work and cover the shifts, I would gladly go and cover that shift. So basically it's commitment to duty, advocacy, and being accountable, even for the actions. Even when you are working as a nurse and a midwife, you have to be accountable to the services that you give to the members of the public.
Interesting, quite interesting. You mentioned that you love working. You loved working in the ward, delivering women and seeing newborn. Maybe just share with us one of the exciting moments in your line of work as a midwife, working in the ward. What is that one moment you look to and say, oh, that was exciting, or maybe that was awful for me, maybe a better term.
Okay, so maybe I'll just mention my two happy moments and the sad moments working as a midwife in the hospital. So the happy moment was a client that was having their first child. After 10 years in marriage, she didn't have a child, so that was a special child. And so when I got in touch with the client from admission ward, I examined that woman, and throughout labor, I was able to give emotional support. And the excitement that came through when she delivered the baby was alive. So when you have a baby that is alive, is happy and active, we call it APCA score, like you give 9-10 APCA score. So the mother was happy, she had this baby, and the husband and the families were very happy. So I don't forget that client. We continued having that relationship with that client, I think for 5 years, and I lost touch. Yes. So again, one of the most unfortunate incidences as a midwife, I was on night duty. We used to be 4 midwives when I was working in neighbor ward. So we had a client who was a young lady. She was a young lady and she was having the first pregnancy. So she came to the hospital and she had high blood pressure, pregnancy-induced hypertension. That is what we call it in midwifery. So when she got admitted, her blood pressure was high, was very high in pregnancy. So she was advised to have a cesarean section on her. And basically, I think the husband didn't allow her to make that decision for her to go to have a cesarean section. So they went home. So when they went home, after a day, they came back, and I was on night duty. The lady came back, and she was puffy, she was swollen, and immediately she came in labor ward. We assessed her, and we had to make a decision. But we couldn't make a decision because the husband was supposed to sign the consent. In the moment of waiting for the husband to come back now to make a decision, that woman fitted, took to theater, and she died. And so that was a very sad experience, because it meant that as women, as pregnant women, they are not given an opportunity to make a decision for their own health. You have to wait for your partner, also your husband, you have to help you to make a decision. So I felt as a midwife, I think the community, they need to undergo health education so that you tell them the complications of pregnancy, and that some decisions they have to make them right, and then for us to save women that are in labor.
Okay.
Yes.
So now back to making a decision. So what decision in that instance was supposed to be made? Is it to save the mother or to save the child? Is that the decision? Was that the conversation then?
So the conversation then was to save both the mother and the baby. However, when you have eclampsia and pre-eclampsia, there are complications that arose. So the complication that arose affected the mother, and she bled. Once you start bleeding due to complications of eclampsia, it becomes very difficult to manage. We are able to manage some conditions, but for that young lady, we were not able to manage. So we lost both the baby and we lost the mother, unfortunately. And so it was very difficult for the husband to understand, but it goes back to the decision that was made when she was initially admitted in the hospital. Mm-hmm. Yeah, so when you are managing a client or a pregnant woman or a patient, you have to bring on board the patients, their families, so that when you are making decisions, you give them health education so that they can make an informed decision for best outcomes, health outcomes.
Okay, so to avoid such, you mentioned that the community should be sensitized so that they are aware of making such decisions. But the concept, the letter or the form, the consent form, is supposed to be signed by husbands. They are supposed to sign as well, or who signs, who gives consent as to in this instance?
Okay, so as it is now, an individual that is 21 years old. They're supposed to make their own decision once information is given. But I think for women, because of our cultural teachings, you feel that you want your husband to make a decision. As you are making a decision, as a woman, it's like the husband has been given authority, even in your health issues. So they have to be there to support you, to give that decision. So that's what happened. That lady could have made a decision on her own to sign the consent, and so that she could go for cesarean section. But once the husband said no, she couldn't.
What about her relatives?
No. I don't know, but
I think it's the husband supersedes the relatives.
The husband supersedes authority over the wife.
Yes.
So even when relatives are there, when the husband says no, I think I remember that client, he left against medical advice. They had to sign to go against medical advice, and when they went, and they had to come back when there was a complication. So that was very sad. Very sad. I remember hugging an auntie to that client who cried on me, so I had to hug her because even me as a midwife, I was affected. Yeah. So in that moment, there are moments when you want to cry together with the client, because then what has happened? Unfortunately, you've lost your life. Yeah. Okay.
Interesting. Yeah. Now let's talk about the standard. Tendai, the nursing profession quite does a lot in terms of shaping the different schools we have, shaping the next generation of nurses by various means of academic exercise, the quizzes, the debates, and everything else. We have different organizations coming up and institutions to promote that.
So different institutions are coming up to promote the nursing and midwifery profession. So what's your take about having nursing schools having competitions or debates?
Oh, thank you, Tendai, and for the question. So nursing and midwifery profession is evolving. It evolves. And so we experience new technology, innovations, and also some diseases that we never used to have a century ago, even when we had COVID. But for me as CEO for Nursing and Midwifery Council of Zambia, we are able to regulate education and training of nurses. But referencing to the quiz that nurses and midwives had, the recent quiz, for me, I was excited. I was excited because the questions that were being asked to our student nurses and midwives were related to what is in the curriculum, because we have a standard document that we implement in all training institutions for diploma programs. and I was happy that the stakeholders that were involved there were senior nurses and midwife lecturers, the quiz master, as you call him.
Yes.
He's an experienced lecturer. And so I think this quiz is making student nurses and midwives to think outside the box. I think when I was being trained myself, we used to go to the library to go and study. You are fighting for one reference book in nursing, for nursing and I think for medicine and surgical nursing. So you'd have one book that you want to all study. But now I think we have technology and we have research that is conducted. And so nurses and midwives, the students are able to research, to get new knowledge. So that quiz expanded their thinking outside the box, to be able to read and also inquire, be more inquisitive. I was happy that one student challenged the quiz master when he was being asked. I remember because I was watching, I was following up, and he was able to challenge. And so we want student nurses and midwives to challenge us, even as lecturers. We can be senior nurses, but we can also be challenged. So when a student is challenging you, meaning they are able to research more and they know their content in nursing and midwifery. And I just want to mention that nursing and midwifery is a science. So when it is a science, it expects students to learn more of physiology, philosophy, different aspects of nursing and midwifery. So I was happy. I think it is promoting nursing and midwifery students to improve their education.
Do you think we need more of the quizzes which can be done to improve the nursing and midwifery profession?
Yes, we need more of that. We need more of those questions and quizzes. And for me, for some questions that we're not able to answer, I was like, the quiz master would read the question, then I would answer. Then I see my students struggling, and I felt it was an answer that could have been easier for them to answer, but they struggled. And so from that quiz, the experiences, they need to learn more to improve our nursing and midwifery education. Also, it gives an input. Also, the institutions, I think you saw how excited institutions were. The highest performing institution, even the second best, whether it was number 4, number 5, they are encouraged. Yes. I'm sure they'll be able to prepare their students more for the training, and also so that they make sure that they are best students. So it's exciting, and I was happy to say that.
Okay,
yes.
That's really good, because it's one thing that's helping the Nursing and Midwifery Council to have quality nurses, because we need quality nurses to be able to treat the patients out there. And now we can move to talk about the Indaba. First, what is an Indaba? I think most people would want to know what an Indaba is, because we feel not everyone will understand what an Indaba is when you put it like that. So what's an Indaba?
So Indaba is basically a conference, more of a conference. Indaba allows professionals to discuss. For us, nursing and midwifery, Council of Zambia, we felt that we needed an Indaba because nursing and midwifery service delivery also faces a lot of challenges. During training, education of nurses and midwives, in practice, where our nurses and midwives are also offering nursing and midwifery services, we have stakeholders that are involved. So we have patients, we have the community, we have organizations that support nursing and midwifery. And for us, we felt that this Indaba will allow us to have a discussion, a real discussion on how we can improve nursing and midwifery education and practice. So it's more of a discussion, but scientific discussion, so that you have evidence-based practice issues that will help us improve the profession.
So what do you expect at the Indaba? What do you expect of nurses during this Indaba? Because I want to believe like a target market are the nurses. So what do you expect of them? What should they expect at the Indaba?
Okay, so our Indaba, our primary target are the nurses and midwives, but we also extend our invitation to our stakeholders, directors that are owning training institutions, both the private institutions, health facilities, organizations that are supporting nursing and midwifery. But overall, for nursing and midwifery as a profession, we're inviting our nurses and midwives to come for this Indaba because it will give them a platform for them to gain the CPD points through continued professional development, because then there will be discussions there, there will be research that will be presented. From my discussion earlier on, I said that nursing and midwifery is evolving. So we have current research that will provide evidence-based measures that will help nursing and midwifery. We also have a keynote speaker that is coming from our region that will make a presentation in education and training, and many other presentations on entrepreneurship. You know that healthcare delivery, there are many opportunities for nurses and midwives to be able to engage in to provide healthcare services. So this will give them an opportunity. We are talking about unemployment for nurses and midwives, but for them to have entrepreneurship activities that will help them to be independent and to provide services even to the community in healthcare delivery. So it's an opportunity for nurses to learn, to network with colleagues, to see on how they can be able to improve practice. So we'll have hospitals that would that have performed better in service delivery to tell us the experience, what they've done best, for them to be a facility where clients are happy to go to. So we want to have less complaints from the community. For us to lessen the complaints from the community, we have to get together as nurses and midwives and see on how we can improve, because we exist for the members of the public and the patients. So we are here for the public. A nurse and a midwife is here for the members of the public to be able to provide nursing and midwifery services which are of quality. So it's a platform that will help us improve in those aspects. Yeah.
That's really good. I feel it's more encouraging to the nurses, so they may attend the Indaba, which will benefit to some of the benefits you've talked about, more especially on the entrepreneurship part, because we're looking at the number of nurses who graduate every year and they remain to be in the community, not knowing what they can do afterwards.
Very true.
Yeah.
And I think also many of amongst the interesting points is because then the Indaba brings along different nurses from different parts of the country.
Yes.
And so it's also, I think, a time for them to network because it's and then also just share best practices that can improve their line of work either at a facility. Because I think it's during such interactions, such occasions like the Indaba, where you share your experiences in Livingstone, from where you're coming from. Because I think we have facilities as far as Chilubi, Chiyengi, Mwinilunga, and all those Zambezi. So they are, and then when they come together, they share the experiences and they keep on strengthening each other, and of course, keep upholding these best practices that continue showcasing or showing that, of course, indeed, nursing is there to save lives despite where one is being posted or maybe where their workstation. But maybe also of interest is what you had mentioned, the CPD. I understand they are supposed to gain some sort of points to maybe just also highlight the importance of someone, a nurse, attending such and getting the CPD points. What does it mean for a nurse going forward?
Okay, thank you very much. So CPD, it is continued professional development. You and me, you agree with me that when a new graduate qualifies, they start working. They keep on learning new ideas and new innovation ideas in education and training, and also what are the best practices. So we as NMCZ has made it mandatory for nurses and midwives to gain CPD points, minimum of 20 points, for them to improve their knowledge and practice, which is skill acquisition. And so basically it is encouraged the nurses to continue reading, because as a nurse you are not limited From you being a diploma holder, you can aspire to be a professor in nursing and midwifery. However, you have to continue to improve and update your knowledge in nursing and midwifery, and basically the Indaba will give that platform for nurses and midwives. And sometimes as nurses we're secluded at a facility. I have nurses that have worked for facilities for a long time and they do not leave that facility, basically because they are short-staffed and they are not able to learn from other colleagues. But the Indaba will give them that platform to learn the best practices. And so as that, it will help them to gain the CPD points. And just also, like you said, network and collaborate. One item I want to mention is also training of our nurses and midwives in training institutions. Many times the public will tell you that, no, Registrar, where we're coming from in independence, we only had public schools. Nurses used to behave in a certain manner, student nurses and midwives, and the performance of students was better then than now. And so, but why do we have the low pass rates, for example, for nurses and midwives? And so for us to come up with an answer to that, we need to conduct research. However, we know that we can assume some of the assumptions on why we are having low pass rates. For example, I will talk about over-enrollment of student nurses and midwives against the standards of managing and implementing diploma in nursing or pre-service programs. So what the council has done is we've regulated the intakes, the number of students to be enrolled per intake, so that we can align them to the standard that we need. Because a student that has been in training for 3 years, we expect them at least to be able to pass the courses at a minimum of 50% pass rate. But it is not like that. The pass rate has been average 50% for some programs, below 50%. The biggest program, registered nursing program, we had 47%. And so where we're coming from, when we used to be trained, you could have 100%, you could have 98% pass rate. But now we have institutions, they're implementing the same diploma in nursing and midwifery. So the same program, another institution has 98%, 92%, 85%, but some institutions have 0%, 5%, 6%, 8%. So the Indaba will give them an opportunity to say, the institutions that have 92%, how are you implementing the curriculum, so that we can also learn from that, so that maybe we can have a better pass rate from those nursing institutions. But I just want to mention that nursing and midwifery training is not basically about theory. They have 70% of practical acquisition of skills. So they have to learn on how to admit a patient on the wards. How do you admit a patient? How do you conduct procedures for the patients when they come to the ward? So they should have the knowledge, but they should be able to perform as nurses and midwives. For us, in nursing, we call that a nurse or a midwife should be hands-on, meaning they have to manage a client with adequate knowledge that they have.
Interesting. So you have mentioned institutions also, because you, I think, nicely put it in terms of the pass rate. We've seen, of course, a difference from back then in the olden days and what we are seeing today. And of course, that could be attributed to the number of schools, the influx of schools we are seeing, and different interest or areas of focus in terms of the subjects and the like. But also, the Indaba gives such institutions a good platform for them for you, of course, as feedback from the council, and for them as a way to go in terms of even improving the results of their students. How are you, as the council, ensuring that these institutions, for example, maybe schools or even health facilities, attend the Indaba? Because from my own understanding, I should think even every hospital, every clinic, health post, facility should at least send at least 2 of their nurses, midwives, to come and attend this Indaba. So what methods have you used to engage them? What are they expected to do as institutions?
Okay, thank you. So what we've done, we have used various modalities, engaging health facilities and training institutions in order to send nurses to come for the Indaba. We have written to the provinces. First, I want to mention that we wrote to the Ministry of Health so that we could invite our nurses that are coming from the provinces through the provincial health directors, because that is where we have our senior nurses in the provinces, and they will be able to identify the nurses in those facilities. We know that the nurses have to work, but they need to have a representation per province to come for the Indaba so that they can be able to learn and share the information with the colleagues that will remain working in the health facilities. For the training institutions, we also wrote to both public institutions and private institutions. Just a few days ago, we had a virtual meeting with learning institutions to give them highlights of what will happen at the Indaba and what they should be why they should be motivated to come and attend this Indaba. So we are using various platforms, including this platform. We are encouraging the nurses and midwives and all stakeholders that are interested in nursing and midwifery to come and join the Indaba, so that then we can get feedback and be able to improve nursing and midwifery education and practice. It could be good if we could have a patient that would maybe might have a good experience from a certain health facility, just to mention, to advocate for the nursing and midwifery profession, because we know that also patients have their rights, but also as nurses and midwives, they also have rights to be respected, even as they care for members of the public and patients.
Talking about rights, I think that's a part where we never talk about very much when it comes to health profession. We always preach about the rights for the patient, but we never preach about the rights for the health practitioner, let's say the nurse or the doctors. How do you feel the public should also take that? Like, do you think it's important that the public should also take into contact that the nurses and the doctors have their rights?
Yes, I think we need to actually give more information to members of the public. Let me concentrate more of nurses and midwives, yes, because I feel the public, they might not have enough information on the scope of a nurse or a midwife. So basically, when they go to a hospital and then they find that there are no drugs, and then the public will just unleash all the negative sentiments to the nurse. A nurse is expected to be a medical doctor, a nurse should be a pharmacist, a nurse should make sure that everything that is supposed to be in the hospital is there. But nurses also, they have their scope of practice. They have limitations. And so that is why we want to sensitize more the public. We want to sensitize so that they understand the role of a nurse and a midwife in reference to care, because nurses and midwives are found at each and every facility. And our members of the public and patients, they want the best in nursing and midwifery care, but sometimes there are challenges. Nurses face challenges, so they might not have adequate resources. However, the members of the public, they just say, no, I don't know. This nurse kept us waiting. The results took over 5 hours. When it is a laboratory technician, is supposed to give results, and not necessarily a nurse. And so the members of the public, I think they need to also know that health practitioners, they have rights. They have to be respected. They have a scope of space where they work from.
So all that will be addressed at the Indaba?
Yes, so that is why we are saying that even the non-nurses, they are stakeholders. Members of the public, they are stakeholders. The media, they are stakeholders. So we want them to come to the Indaba so that then they learn what nursing and midwifery is all about, what does it take for a student to be trained as a nurse or midwife, and practice what are nurses expected to provide when they are working at a health facility. Yeah.
So in essence, the Indaba has a lot of benefits to actually the nurses and the institutions they are coming from, isn't it?
Exactly. Many benefits, actually. Many benefits. And we are hoping that this is the first Indaba that we're going to have, but then it will also help us project. We want it to be an annual event every year, so that we learn the best practices. We want members of the public to have nurses that have a positive attitude. They come to the facility, the nurses are smiling, even when they do not have resources, but they are able to explain. They have an open communication with the client, and so that they're able to make an informed decision and they will be able to understand. And so all those aspects will be explained at the Indaba.
Okay. I think many would be wondering as to how do I even get myself to be attending this Indaba. I know many facilities have responded to this call, and I think many nurses out there will be attending. Maybe just speak to how much is required for one to attend, and just also those institutions, especially the hospitals, the health posts, the schools, those ones dilly-dallying to pay maybe for their nurses. Speak to them and see why they should. There is a need for them to do that, to sponsor their employees.
Okay, so let me address I'll start with the training institutions because their interest is the student nurses and midwives. The council has opened the platform even to student nurses that are supposed to pay 2,500 kwacha and also 5,000 for the qualified nurses and midwives. Why the Indaba is important for training institutions is because the students are going to learn on what they're expected, how to perform and how they're supposed to handle themselves, professional conduct as nurses and midwives. And also the lecturers, they are going to learn the best education practices of other facilities, other training institutions that are performing well in training of nurses and midwives. And also the directors of institutions, the ones that are owning nursing institutions, I just want to encourage them that if they want their training institution to be performing well, they should send their lecturers to come for this Indaba, because then they are able to learn on which modalities are we going to use to implement the curriculum better than where we are coming from, so that the students are well equipped even as they sit for competence and licensure examinations. For health facilities, I think the most important issue is practice. We have standards in nursing and midwifery on how we are supposed to nurse our patients. And however, in this Indaba, I think there will be presentations on practice, best practices, research which is evidence-based, what is current, and it will give a platform for senior nurses and midwives to be able to improve their facilities in relation to nursing and midwifery in provision of quality of nursing and midwifery services. And so we just want to encourage the leaders of the health facilities and also the provincial health directors to support the nurses and midwives from the provinces where they're coming from. Because we are getting sentiments that we are told that nurses, you're supposed to work on the ward, you don't need to go and attend this Indaba. But this Indaba will help them to improve service delivery. So we are encouraging them to support the nurses to attend this Indaba in Livingstone.
Interesting. And maybe as we just conclude, I don't know if there is anything left that we would want to address with regards to nurses, especially those ones in practice, to come and attend the first ever Indaba for them. Your encouragement to them, even maybe at personal level.
Okay, for me, being a nurse and a midwife, as a country, I think this is the first ever Indaba that we are hosting as nurses and midwives in the country. So it will give us nurses an opportunity to discuss various achievements as a country that we've made, and also the challenges that we have, but how do we agree to improve the challenges that we have as nurses and midwives. So it is important as a nurse, just find it an opportunity for you to come for this Indaba so that you are able to network, you are able to learn strategies of entrepreneurship in healthcare delivery, which are open, and the space is there for nurses to learn. So it is very important. I want to encourage them to come for this Indaba because the platform is there for them to learn, and also we want to hear them. We want to get their feedback We are a regulated body as Nursing and Midwifery Council, but then them are they are our first clients, the nurses and midwives. So we also want to get feedback from them on how we can also help them to strengthen nursing and midwifery profession in the country.
Interesting. So, dear nurses and midwives, this is the time for you to visit Livingstone. And of course, you visit for good reasons now, attending the first ever Nurses and Midwives Indaba, which will be in Livingstone. Of course, you can check the NMCZ Facebook page.
Yes.
The information is there. Now you can register, and the exact dates, month end of this month, October. And so just start preparing and get ready to attend these. Speakers have been arranged from different parts of the country, of course, in the profession. And of course, we have the guest speaker, the keynote speaker, coming from Kenya. Is it Kenya? Yes. She and Eswatini.
Yes.
She will speak to best practices. Of course, we can share knowledge in that regard. And of course, the event is going to be graced by His Excellency, the Republican President, Mr. Hakainde Hichilema, who will be at the ceremony. So this is a beautiful opportunity for you to shine as nurses and continue upholding the good ethics and standards of the nursing profession. Well, of course, even as we let you go, you were mentioned of professional conduct standards in nursing. It will be very unfair for our viewers who are listening to us not to discuss the most recent trending video of the Copper Belt girl
Who sang a certain
who sang a song and rapping. And of course, the NMCZ issued a statement regarding to that. We would just like to speak to, of course, there are a lot of social media commentators who might also want to understand what is regarded, what is needed really for what is expected for one who is a trained nurse. Are you being harsh on the young lady?
Or their code of conduct or code of ethics that's supposed to guide a nurse how they should carry themselves. That's what I feel most nurses out there and the viewers would want to know.
Thank you very much. I was actually expecting that question to be posed by you. So I just want to mention that nursing and midwifery profession is a regulated profession, and so nurses and midwives subscribe to the code of ethics in nursing and midwifery. A student that has enrolled in a nursing program, they are taught a course, professional adjustment, to allow them to be able to actualize expectations of them being nurses and midwives. And therefore, the code of ethics, it guides how nurses and midwives should be able to conduct themselves in uniform. And so, actually, there are aspects that you as a nurse and midwife, you cannot be able to do and conduct yourself when you are in a uniform. Just to comment on that video, I think a nurse and midwife who's excited and graduating, you can be excited and post a video, but I think there's a language that was used in that video, which unfortunately does not represent the profession. Okay. And basically, it's not really about the video itself, and we have aspects of nurses that will be negligent. And members of the public, they will align the negligence to what was trending in that video. So for nurses and midwives, they are regulated. It's a profession that is regulated, and professional conduct utmost is very important. Yes. We have guidelines on how to use social media for nursing and midwives in the country. And so we want to maintain the integrity of the profession itself. This is a profession that is respected. You can tell me that I don't think you see a lawyer that is on TikTok and he's saying unpalatable language on TikTok, even defense forces. And that is how nursing is. Nursing is a profession. It is respected. It's a noble profession. So we expect nurses to behave in a professional manner. We want them to be empathetic, to be compassionate, but also protect the integrity of the profession that you've joined. Yes. I mean, this is the excitement. True. You can be excited, but you have to manage yourself on how that excitement goes while you're in uniform. Okay. And so basically, we are not being harsh to the young nurse. She's a young nurse who has joined the profession. However, disciplinary measures they are instituted according to the conduct of NS.
Right.
And basically that is why we issued the statement by Nursing and Midwifery Council of Zambia, so that we are able also to reprimand other nurses and midwives that that shouldn't misrepresent the profession. Yes.
I think that's a lot to every nurse who's out there. Probably they learned one or two things from everything. And I believe at the Indaba, all this will be addressed about the ethical code of conduct. So to all the nurses out there, please, and I say please attend the Indaba, because they're going to learn different things. They're going to know how a nurse should conduct themselves, what's supposed to be done by a nurse at every point.
Thank you.
Thank
Well
you.
articulated.
Yeah.
You being a nurse yourself.
Definitely, because we read the code of conduct and it's read to us time and again, so we need to know how to uphold the profession.
Yes, thank you very much.
Thank you.
Yeah, so I think it clears what most social media spectators are indicating regarding the maybe the NMCZ council being harsh on the young lady. I think it just speaks to what guides a certain profession, and I think it's everywhere in almost every profession.
Yes.
Yeah, so despite the excitement, I think it should be somehow managed in a certain way, and at times when certain things are done, a certain route unfortunately should be taken, so that maybe it sends as a reminder and a warning to even other people.
Already 7.
Yes. Maybe now as we conclude, maybe just an emphasis towards because I think for now what is critical and what every nurse should be looking for is the Indaba.
Yes, exactly.
Because this is a big event. This is one of its kind, the first ever in Zambia, and we expect quite a number of people have responded. Nurses have responded. Speak to that as even as we conclude our discussion.
Okay, thank you. For nurses and midwives in Zambia, this is our first ever event. This is an event that nurses and midwives should honor. You should honor, this is our profession. And for us to improve the profession, we have to honor it by registering and coming to attend this Indaba. There are many aspects that we are going to discuss in nursing and midwifery, and further we are going to award nurses, deserving nurses, that have contributed to education, have contributed to practice, academic excellence, training institutions that have exhibited best education and training aspects for student nurses and midwives. And so we just want to encourage our nurses and midwives to be able to come and support. This is a conference, this is an Indaba that is their own. And so we are invited to other Indabas, but this is like a baby in the house, and we have to accommodate it. So we just want to encourage the nurses to push so that they can come and attend this Indaba on the 29th of October to 31st October 2025. So please, even that money that you've put somewhere else, come and learn entrepreneurship opportunities. You are going to learn aspects and think outside the box. Other than that, working in the hospital, you can come up with cooperatives of nurses and midwives who work together to provide services to members of the community. But at this Indaba, that is why you are going to learn the concept, because we have a nurse that is going to present on that have gone that route. So we just want to encourage you to come and attend this Indaba.
Interesting.
Yeah.
Tendai, are you attending the Indaba?
Definitely. I need to become an entrepreneur because I need to think outside the box. Apart from working in the hospital, able to collaborate with other nurses. So maybe we can also start up a nursing school. You never know.
Interesting. I'll find time to also attend. Maybe I might be converted to becoming a nurse.
Yes, you can be. You're actually an honorary nurse. So you can come and join us.
No,
Yes.
I will. So there you have it, ladies and gentlemen. We're having a discussion on the Smart Podcast with Madam Beauty Zimba, the Chief Executive Officer and Registrar of the Nurses and Midwives Council of Zambia. We've discussed quite a wide range of affairs, of course, starting from where she started as a registered nurse Of course, I did education, went into working as a midwife, of course, the university teaching hospital at UTH. And of course, until she rose and, of course, climbed the ladder of leadership, where she's sitting today as CEO of NMCZ. This is Gift Kalaba, and of course I was joined by Tendai, hosting the Smart Podcast. Remember, this podcast has been sponsored by Elitrasmart Medical Supplies Limited. Till the next episode.
Hello everyone, my name is Constance Kunda from Elitrasmart, partnering with NMCZ. In preparation for the Indaba, we are here at Eden University, interacting with students, just knowing their thoughts about the upcoming Indaba this month end. And I'm here with...
Hi, my name is Mo Blessing Tarona, a student at Eden University under the School of Nursing and Midwifery Sciences in the Department of Nursing Sciences. I'm doing a diploma in registered nursing and I'm in my final year.
Okay, Blessings. So tell us, what excites you the most about this upcoming Indaba being organized by the Nursing and Midwifery Council of Zambia?
I think as a student, attending the NMCZ Indaba will help me to interact with fellow students from other schools and to interact with our nursing tutors and nursing educators. This will help me to boost my confidence in my abilities and to help me to have the confidence to face the challenges that are there in the healthcare system and to be able to think creatively and innovatively about ways to tackle the challenges in the healthcare system.
Yes, that is really exciting. Now, how do you think such events will inspire more students to engage in innovation and leadership?
Okay, I think for students, we are going to benefit as we will be interacting with former students who are now qualified nurses and are very innovative. For example, the owner of Elitrasmart, who has been innovative in the selling of uniforms and is now sponsoring events for students such as the quiz. This will motivate us as students to do more as we are learning from our seniors.
Thank you so much, Blessing, for sharing your thought with us. It is super exciting to see how the NMCZ Indaba is bringing inspiration to our future midwives and nurses. You can't afford to miss this big event. See you in Livingston.
My name is Kambeja Stewart, the region manager for the Southwest Region Office for the Nursing and Midwifery Council of Zambia, based here in Livingston. The Nursing and Midwifery Council of Zambia, we are going to host what we are calling the Nurses and Midwives Indaba, which is going to be hosted right here in Livingston, district of Southern Province. And it's very important to attend this Indaba because it's going to assist in continuing professional development, and as well it's going to be a platform for nurses and midwives to be able to interact and collaborate with each other on the new innovations and many other things. And as well, this, as you are aware, Livingston hosts one of the 7 wonders of the world, which is the Victoria Falls. So you will have access to this, and also we are going to have the Nurses Gala Night, where we are also going to award some deserving nurses. So it's very important that I invite nurses and midwives from different organizations, different hospitals, different clinics to be able to come and be part of this very important event. And I encourage clinics and non-governmental organizations, district health officers, provincial health officers, and many other organizations, hospitals, so that they are able to support their nurses and midwives to be able to be part of this very important event. Thank you so much, and I can't wait to see you here. Thank you so much.